So now we're gonna work a little bit into our hip flexors, right in the front of the hip. So my group with the ball, we're gonna grab that softball. We're gonna be laying on our stomach. If you feel the front of your hip, you'll feel a little piece of bone there, your ASIS. We're gonna drop below that piece of bone into our hip flexor. We're gonna lay on the ball, taking pressure down through that ball, bend our knee, this is all on our right side, and we're rotating in and out. So we're going through internal and external rotation with pressure through that ball.
Are you sure you want us to do that?
I want you to do that for 2 minutes. And now with the bands, what we're gonna be doing, we're gonna grab this band, we're gonna step our right leg through the band. We had some ab mats here because it's pretty uncomfortable to kneel on the floor for 2 minutes. Step out in front. Our right knee is going down onto the ab mat. We're gonna drive our hips forward and reach our right hand across our body. And we're just holding. We could also add some small pulses in there. The further that band is out, the more of a stretch you're gonna get. Good, and let's switch sides. The bone that you can feel, drop below that. That's where the ball is going. You don't want to over the bone because that's just going to irritate you. Okay. And now you're trying to rotate your leg in and out, so you're keeping that pressure, and we're going in and out like that. You can reposition the ball as you need it. If there's an area that's more uncomfortable, hang out there. Once we're there, small pulses. Try not to give up the range of motion. Try not to come out of the position at all. You're holding that end range and just small pulses there without giving up the position. And everybody relax. So I realized I cheated you guys out of one thing for the hamstring. Even Iron Don forgets. My group with the band then, you're gonna put that loop around your right foot, lay with your head towards the rig. You're gonna be pulling your leg down towards the ground, keeping it straight, and slowly bringing it back up. Everybody over here is going into your squat. You're holding. If you need to, feel free to grab the pole to hold you into the position. If you find it very difficult to maintain your squat, we also have some spots over there on the rig, so that's not cheating. You can use the post to help you get down there. This is not a strengthening exercise. This is meant for your mobility. I want you guys to just straighten out the opposite leg too. That's gonna rest flush with the floor. Yeah, and that's good. You could absolutely go side to side a little bit, hunt out any of those tight areas in the hips. That's absolutely fine. I want you guys to try to keep your toes relatively forward. We could have a slight external rotation, but we don't want to be like completely duck-footed. Sometimes we'll do that to make up for limitations in our ankle or our hip, but we're going with just a slight toe out here. If you can't get down into that position with the heel flat, just grab onto the post and use that to help you get further into the squat. You're good with the feet. Try to straighten out your back a little bit. There you go. All right, now let's switch sides here. Put the band onto the other leg. Squatting, you're staying down. You should get to a point where 10 minutes in this position is effortless. Group with the bands here. Try to keep your toes pointed towards the ceiling on both legs. If you're a little bit tighter, one part of your hamstrings, your toes will want to rotate either in or out, usually out. So we're just trying to keep those toes straight up. And everybody's going to relax. Shake everything out. Our group working with the ball, we're going to feel the front of our hips. On the right side, you're going to feel a bony prominence in the front there. We're going to drop just below that bony prominence. That's where we're going to place the lacrosse or the softball. We're going to be laying on our stomachs, taking our weight down through that ball, and rotating our leg through internal and external rotation like that. Our group with the band, that you're going to step your right leg through that band. Bring your right knee down to the ab mat. The ab mat should be as far away from the rig as you can tolerate. Bring your right foot down to the floor, left foot down to the floor. It's going to be in front. So we're like this. We're going to drive our hips forward, keep our shoulders back, reach our right hand across to our left side. From here, we're doing small pulses at our end range, but we're not coming out of the position like this. We're not giving up the range. We're just doing small pulses here You should feel this all through the front of the hip, and you may feel it down the thigh. Get some pressure down through there, and we're going in and out. And let's switch sides. Here we're working on hip flexors. We're working through the muscles over in our group with the ball there. So they're taking as much pressure as they can down through that ball, getting an active release by internally and externally rotating the hip, freeing up the hip flexors, commonly tight muscle, especially with the amount of time we spend with those muscles shortened when we're sitting. So we're down here, that muscle runs across my hip. That's gonna be short, tight. Those muscles also help to stabilize the low back. So hip pain, back pain, those are a common player. Over here, we're again stretching those muscles, but we also have the band. So we're gonna be working through the capsule of the joint, thick connective tissue, trying to get that to release a little bit as well.
Sweet.
Everybody shake it out again, take a quick minute break here, loosen everything up. Next, we're gonna be going into some stuff for our shoulder.